The Trump administration's purge of the entire CDC committee responsible for recommending vaccines has local doctors, especially pediatricians, worried about the return of childhood diseases. Vaccines for measles, mumps, rubella, hepatitis, chickenpox, polio. The list goes on. Pediatricians at Northwestern Children's Practice have so much confidence in the safety and effectiveness of vaccines, the Chicago practice only allows patients who are vaccinated.
We feel that it's the most important thing that we do here to keep kids healthy.
Dr. Scott Golding says throughout his career, he has trusted the recommendations from the Centers for Disease Control's 17-member Vaccine Advisory Committee, known as ACIP. Yesterday, Health Secretary Robert F. Kennedy Jr., a vaccine skeptic, fired the entire panel.
The very act of getting rid of them and replacing them at all, you're giving parents less confidence in something that they should have every confidence in.
The unpaid 17-member panel are vaccine experts that include researchers, physicians, pediatricians, and nurses.
It's the gold standard for vaccine recommendations for the United States and probably for most of the world.
Retired UIC infectious diseases chief Dr. Richard Novak spent his career working on vaccines. He says the CDC committee is impartial and only makes recommendations based on years of scientific data. Novak says typical vaccines take about 30 years to develop.
They're very well vetted. We have tons and tons of safety data, particularly about the vaccines that we use every day and have used for decades.
For the safety and health of the public, Novak and fired committee members hope Kennedy chooses experts to serve on the new committee. But Dr. Noel Brewer, a terminated member, says he fears Kennedy will not.
I've heard some names mentioned, but I will wait to see who actually ends up being nominated. I assume they'll have the same level of vaccine skepticism as the current secretary.
The CDC's advisory panel is scheduled to meet on June 25th. The U.S. Department of Health and Human Services says the meeting will go on as planned, but it is unclear when Secretary Kennedy will replace its members.